Right now, it is 7:06. We are more than a year into this pandemic. We are learning more and more as we go on about what's happening, vaccination. What are they? What are the symptoms? How serious can they get? Where do we stand right now? Joining me, an expert on this topic, clinical pharmacist Amir Amani, joining me now. Good morning to you, Amir.
Good morning, Melanie. Thank you for having me.
Thank you so much for joining. One of the things that you do as working at a rehab hospital is looking at some of these long-term effects, these long-term impacts. So let's begin there. What have you seen post-ICU? Because right now we're talking about the intensive care, but once patients are released from there, if they are lucky enough to be released from there, what happens next? What are you seeing?
Well, the thing is, COVID, like many other infectious diseases, is known to have a risk of complications after illness. And this isn't new. We've known about these complications for a long time. We know that despite being caused by a respiratory virus, COVID can affect several organs, not just the lungs, but the brain, the heart, the kidneys. So what I see are people who I see some of the survivors. They got COVID, they got through it, but now they need a lot of help to get back on their feet. So I see people who now need to start taking an inhaler. They get short of breath when they go up a flight of stairs. People who need new medications for their heart. People who need blood thinners because COVID has a substantial clotting risk. We know that out of every 20 people that are admitted to the hospital with COVID, about one of them will have a clot. And ICU, what concerns me about our ICU burden is because getting admitted to an ICU is no joke. It takes a heroic amount of effort to keep someone alive there. And some of the interventions that are needed to save someone's life can come at a cost. So many of the people who have to spend a while in the ICU, when they come here, we see that they've developed nerve damage, pressure wounds, other infections, muscle wasting. And all of these things take time to recover from if you do fully recover. But I think we need to talk about this one because too many Canadians tend to think that it's either you're fine or you're one of the rare few that pass away, but there's a vast distance between those.
Indeed, there's so much more that I think, and so thank you for bringing this subject to us because, we've heard about the long haulers, but even breaking up the long haulers and the types of effects that they're seeing in the rehab that's needed. What about the younger population? Because I continue to have conversations with people who say, listen, a lot of people didn't have underlying complications before. They're going to be fine. That isn't necessarily the case. And now we're seeing, when it comes to these variants, a lot of younger patients being admitted to the ICU and then potentially seeing you after that. So what have you noticed when it comes to the population and those patients that are needing to be treated?
Well, we've noticed globally that a lot of in several countries, that progressively younger people have been filling up our ICU since the pandemic started. Rehab tends to come after ICU. So when I hear about 30-year-olds, 40-year-olds in the ICU, I get a little worried. We are seeing in rehab, we do see an increasing age range. Before we might see people who were more in their 70s, 80s, 90s. Now we see a large chunk of people in their 60s, 50s, 40s, maybe a bit younger. Now with long haulers, some of it is very difficult because this is an umbrella term. Some of the long haulers were people who had mild illness and now have some persistent symptoms. And we know a lot of people do. Anywhere from 10 to 30% of people, depending on how severely they were ill, have been shown to have some kind of recurrent or persistent symptom more than a month after illness. But the problem with long haulers is many of them were young people who never got that sick in the first place. So working in a rehab hospital, I don't even get to see them because right now we have to prioritize our most severely ill people. So it's something that we're continuing to monitor. But for now, I think we have to focus on the people that were most severely hospitalized and in many cases needed intensive care.
Amir, thank you so much for joining with your knowledge and insight. And we do hope that we can turn this around because it does, as you mentioned, it does have a domino effect. It's not just a recovery. A recovery doesn't mean everything is 100% better. And we'll be seeing the impact on our healthcare system down the road as well. Amir Amani, thank you for your time.
Thank you for having me, Melanie.
All right, it is 7:11. We are going to revisit our breaking news coming up in just a bit about Prince Philip. Again, that just coming into our newsroom that he has passed away. We'll bring you more details in that in just a little bit as we gather that information. Right now, though, we go back to the studio.